becoming a doctor in India is becoming really difficult. Over 22 lakh students sat for NEET exams this year against around 1.1 lakh MBBS seats.
In Rajasthan, we now have a medical college in each and every district.
Patients expect करते कि हम जब भी डॉक्टर्स को फ़ोन करें, they want them to answer it. Patients have also forgotten that doctors have a life. Like how doctors prescribe a lot of tests, a lot of medicines to meet their sales and revenue targets. How real is this system of targets in hospitals?
If I say that it doesn't exist, I will be very dishonest. It does exist.
मेरा काम है पैसों का हिसाब करना, पेशेंट का नहीं.
हम ट्रीटमेंट आगे नहीं करेंगे, पहले पैसे जमा कराइए, ये करिए, वो करिए, and it puts the family in a lot of stress.
Patients को बहुत अच्छा कस्टमर भी होना चाहिए, बहुत अवेयर कस्टमर होना. And I felt really selfish that I did that because people who were calling were actually struggling, and that was a nightmare kind of a situation.
The other big challenge increasingly is oxygen supply.
And we only have 10 minutes of oxygen left in the hospital.
10 minutes.
Oxygen ventilator. Within those 5 minutes, 4 patients collapsed.
Oh my God. Today's conversation isn't just about doctors and hospitals. It's about those struggles, dreams, money, mindset और वो हर सवाल जो एक पेशेंट, एक स्टूडेंट, एक फैमिली के मन में हमेशा रहता है. From the brutal journey of becoming a doctor to the hidden businesses of hospitals to the AI revolution that can actually turn around the healthcare industry of India. This episode goes beyond the surface to the questions that matter to all of us. Hi Sarvesh, welcome to the Jaipur Inspires show. Thank you so much for making out the time to be here today. I'm really honored.
No, an absolute pleasure, and I'm looking forward to having this conversation with you.
Lovely. So before we begin, I really want to congratulate you for winning the National Award for Emerging Healthcare Leader. You've made your family proud. Jaipur is proud. Tell us, how was the feeling?
Yeah, I mean, of course, it was. I'm very honored to have received this commendation, and of course, I mean, it is not my award. It's a collective award of so many people who are currently working with me, alongside me, people who are mentoring me, my teachers, my family, everyone. I mean, it's a collective award, and it makes me as much proud as anyone else that I could be the one who takes this, who is the face of it. But in actuality, it is a collective endeavor that has given results.
Wow, it's a beautiful way of putting it out, and I'm sure you really worked hard to get here. So, tell us something that you grew up watching your father building Rajasthan Hospital, shaping the healthcare space in Jaipur. So did that build an inclination to actually become a doctor, or you wanted to do something different?
So I think medicine and being a doctor was in the air that I breathed, because there was nothing else that I wanted to do while growing up, and right. I'm the youngest sibling. I have 2 elder sisters, so I saw them becoming these great, having always straight A grades, always really passionate about being a doctor, being into healthcare. There was nothing else that I ever considered becoming. So basically it was just graduate your school, then go into medical school, finish your MBBS. After finishing the MBBS is when I actually started exploring that what right. else can I actually do. That's when my mind actually got that relevant exposure that there are other things also that I may want to do. But yeah, I mean, always wanted to be a doctor growing up. Saw my dad, saw him working for 12 hours a day, 14 hours a day, seeing him being really compassionate towards people. So there's nothing else. I mean, you know how
right,
they say
right.
that your first hero is your dad. So
yeah, absolutely.
Yeah, there's nothing else I wanted to do.
Lovely. So you are currently the CEO of Rajasthan Hospital and also the Managing Director of Swasthya Kalyan Group. Just walk us through your professional journey, your education background of how did you climb this ladder to the top?
Oh, that's very interesting. So as I said before that, I grew up in a healthcare household. My father, both my elder sisters, they are doctors, and they are the ones that are the real doctors. They're the practicing ones,
okay.
Not like me. But yeah, just went into medical school without even thinking about it twice.
Right.
in fact, got out of medical school without even thinking about anything else except for practicing medicine. But that's when I started exploring things. I started my junior residency in hospital as well. Worked my ass off, just, had a lot of fun. But at the same time, I kept feeling that I think I will be more suitable towards entrepreneurship because I just wanted to take charge of certain things which I thought I could contribute to the society, which I thought I could contribute to our profession.
Right.
So उस time पे I made that call. I still remember it was mid December, and I just resigned from my job and came to my father and said that I don't want to do medicine anymore. I'll just do my MBA. I'll go to one of the top 10 universities of the world.
Right.
And if I don't get in there, I'll not go anywhere else. And till then, I would want to work with you so that I can learn some kind of experience, gain some kind of experience, because these MBAs require some kind of work experience.
Right.
So I'll get that with you. So if that's okay, and of course my father has been very supportive in my journey, and he has been very understanding and very open-minded about things.
So you did MBBS from Jaipur, and then you went to Duke University to do your MBA.
So it was like a 3-year gap between them, because those 3 years I worked over there and over here.
Right.
So in 2012 I finished my MBBS, and then 2015 I went to Duke University. And of course Duke was a different experience, because for the first month I had this imposter syndrome. मैं कहाँ हूँ और क्यों हूँ? मेरे साथ ऐसे लोग हैं, people who have sold their companies for $1 million. Then at the same time, people who have been top rankers in the IIT, in BITS, people from Harvard, Stanford, everywhere. So it was, but then at the same time, it gave me a lot of confidence that I could be amongst the top of the top talent of the world and kind of shine out. It was a great experience. I actually did my major in finance and strategy from there, and I did my certificate in health sector management from there. I worked at Cardinal Health. वहाँ पे. It's one of the largest supply chain company of the world. But then when I was in my second year of college, that's when the Rajasthan Hospital project really started. And my father insisted that I come back to India and take charge. So yeah, that's when the decision was made.
So you went to US and then you were working there. I'm sure when you got back to India and you took the leading space in Rajasthan Hospital with the Swasthya Kalyan group, how did you start doing things differently from the learnings about advanced healthcare systems and business practices that you learned with Cardinal Health and while working in the US?
So I learned a lot of organization skills from my time in US. I learned a lot about structured thinking. But I think that the most important part in any profession is the soul.
Right.
So that soul part is all Indian. I mean, the reason why we work, the people for whom we work, the contribution that we have for nation building, that kind of self-satisfaction you cannot get while you're working over there. So yeah, I brought a lot of, design thinking and strategic frameworks to do work. It was kind of difficult at the beginning, but at the same time, it was a lot more fulfilling.
Just tell us an example, like any one of those strategies.
So I'll tell you. So basically, what happens is that during our strategy classes, my early core strategy classes, we used to be taught that any organization needs to have a very strong foundation in your mission, vision, and values in order to kind of create a big setup. And a lot of organizations falter when you don't align your work, your day-to-day work and operations around your values. So we almost took 3 months to figure out that what would be our mission at Rajasthan Hospital. After 3 months with all the stakeholders coming together, we kind of drafted just a one-line mission statement, which was to provide quality care at affordable cost. Now the reason why I'm telling you this is that every operational challenge, every new initiative that we take now at Rajasthan Hospital, we just ask ourselves this question. are we provide whatever service we are starting, is it at par or better with the best quality standards that are out there? And then secondarily, is it affordable? So affordable doesn't necessarily means cheap. Affordable
Right.
means that it should be within the grasp of a large majority of the population.
Right, right.
So if we ask ourselves those questions, if the answer of those questions is a no, we don't do that thing. So we have been very strategically aligned about how we go about work.
Wow.
So I think these kind of foundations help build huge organizations, and I have been blessed that I have people around me who have been veterans in the field, and people who are kind of upcoming stars of the field or established stars of the field as well, to guide me and to be with me. But this has been very fulfilling, and
Wow.
it becomes more fulfilling because you have a lot of appreciation, and getting appreciation from people around you,
Right. It gives you a push.
It
gives
gives
that
you a lot
boost.
of push. Yeah.
That's beautiful. I think this is a wonderful thing to learn from the way you've been implementing things since you've gotten back to India. I want to start another segment of this conversation by talking about a very difficult conversation. It's about how becoming a doctor in India is becoming really difficult. Over 22 lakh students sat for NEET exams this year against around 1.1 lakh MBBS seats. I mean, the journey has become so brutal. Excesses of competition, years of coaching, families stretching their finances, constant pressure. On top of that, the private medical seats, they cost a bomb. Do you think that studying medicine is still accessible to middle class and lower middle class India, like the underprivileged people?
So the answer would be kind of a mixed bag over here. Of course, if you have a look at it, we have almost doubled our medical seats over the course of
Yes.
last 10 years. And we have, so you take the cause of Rajasthan. In Rajasthan, we now have a medical college in each and every district of the state.
Right.
So, and these government medical colleges, a large proportion of the seats have gone to government medical colleges. PM Modi just announced another expansion of seats by probably another 100,000 within the next 5 years or so. So yes, the accessibility part has kind of helped, but at the same time we also have to realize that the population that has come up, the population that is out there, the young population that wants to enter into the healthcare field, because for a very simple reason that it's a very respectful and a respectable profession. आज भी लोगों को गर्व होता है मेरा बेटा डॉक्टर है,
exactly.
मेरा बेटा हेल्थ केयर में है, ये बहुत गर्व की बात होती है गाँव के अंदर, तहसीलों के अंदर. So the access and the number of people that are out there, that still is a huge gulf.
Right.
Now the only way that this gulf can be fulfilled, and we also have to keep in context that in shortening that gulf, we cannot compromise on the quality of healthcare. So that is something that we have to maintain. We are opening a lot of medical colleges, but those medical colleges also have to produce a specific quality of doctors.
Right.
Otherwise, after you have completed your entire course, you may not be as employable as you would want to be.
Right.
So that is also there. So yeah, I mean, it's a very difficult thing. But at the same time, I would also like to point out that private medical colleges are probably, and this could be, kind of a biased answer because I am a part of private healthcare entrepreneurship. But private medical colleges have played a very, very important part in creating personnel, in creating manpower for healthcare.
Okay.
Because government could not have done everything.
Right.
The last 8 to 10 years, the revolution that has come because of the painful stakes of the private medical colleges. Yes, it costs a bomb, but at the same time, they are self-financed institutions. So those self-financed institutions, which are, kind of temples of service, they also need a roof and a fan. So for that, things, have become kind of expensive. There is no denying that. And it is going to be very challenging for us as a nation to ensure that we keep it affordable. So that's the balance that we are trying to find. And we are still a very young nation. We are still a very, very developing nation. I think we will find that balance much sooner than later with democratization that is happening in education and medical education seats. This will definitely come in.
Yeah, but this is a fair point for actually from the perspective of the underprivileged, especially
Yeah.
who really want to make it big, who really want to become good doctors. I think adding this as a very big mission in the healthcare industry would actually bring us a lot of talent from the underprivileged sector.
Absolutely, absolutely. There are so many hidden gems that are out there, and the government is doing their bit as well. And I think we should, as private enterprises, we should, and we are doing our bit. I mean, if you think about it, then the way things have changed in the last 10, 15 years, there is now no admission in medical colleges that happens without a person undergoing the NEET counselling. So that has brought a new level of transparency into the entire system. That has brought in a new level of merit into the system. And at the same time, the reservations for certain backward sections of our society, that is there to ensure that they also get a certain amount of access. So I think the right balance is still a little further down the line, but we will find it. We will find it very soon.
Talking about the NEET exams, if you saw like how the papers were leaked, if we talk about that, if we talk about how the Bihar, if you saw the news, like of how those things were scammed, and later people figured it out. What is your take on that?
See, I mean, it only takes one person to leak the paper, and just one person or just a group of very small people to do or dissolve the reputation of what has otherwise been a really, really prestigious and successful examinations.
Right.
I'm not much worried about it. Yes, there need to be some kind of improvement reforms, and government is doing their part in reforming the entire institution. But yeah, I mean, I would not go as far as kind of, challenging the entire premise of having these examinations or the sanctity of these examinations unless it happens pretty consistently. It is an occurrence, a very, very unfortunate occurrence. But I mean, I give kudos, as you mentioned, that 20 lakh people, students gave their NEET examination. So that's, that's probably a percentage, 1 or 2% of the entire population of ours within the age group of 15 to 25. So that's a huge number, and there could be so many things that could go wrong. So yeah, I mean, things happen.
As you mentioned, like becoming a doctor. मेरा बेटा डॉक्टर बना है, मेरी बेटी डॉक्टर बनी है. गांव में ऐसे होता है, वो हमारे घर में कोई गांव वाला डॉक्टर बना है. Like it's such a big thing, such a big achievement for any family जिनके family में से कोई भी एक डॉक्टर बनता है. But the reality of becoming a doctor after they have actually got the degree and all of that, the first few years are so difficult. Long working hours, constant pressure from the top, and then let's talk about their pay. Their starting pay starts from almost like 20-30K per month, or maybe less than that in few institutes and hospitals and all of that. Now, if we compare that with a fresher in tech, उनकी starting stipend 40-60,000 minimum होती है. If you compare the like the pay structure of a doctor in a tech, what is your take on that?
So again, I mean, it kind of again depends. I mean, there are few people in tech who don't come from or don't pursue certain degrees which are very in demand, for lack of a better word, in demand in the market, who receive far lesser pay. But I mean, I completely endorse what you're trying to say or what you're trying to communicate over here. See, being a doctor, getting into medical education is all about grit. It is all about endurance.
Right.
It is not just about the smartness. Smartness probably just gets you that far. But the grit and endurance that you have to pursue for the next 5 to 10 years, it is just amazing. And it amazes me to see that so many people, so many doctors that are made every day are willing to go through that grit. So if you have a look at it, then a lot of doctors actually turn entrepreneurs because they have that grit and they have that endurance to go through that entire system. Yes, it takes a lot of time. Yes, it takes a lot of energy, and the entire family is actually, sacrificing towards the ultimate dream. But when you reach that cusp, it is just so fulfilling. So my entire view on this would be predicated on the premise that a doctor has to take care of the society. That person has to take care of patients. So that person requires a lot of training. That person requires a lot of skill in order to ensure that the baton of basically keeping the society healthy could be passed out to them. So yes, it takes a lot of time, and to go through that entire
it's like preparing
section.
them for every situation.
Yeah, of course, of course. And see, doctors are no more just healers. They just don't treat you. They have to treat the entire family. They have to manage the entire family of the patient. There is a certain level of service that is expected out of them. There are a lot of soft skills that come with it. So it's not just one dimensional. It is very multi-dimensional. Doctors have to be effective spokespersons. They have to be very good communicators. They have to be very good and on top of their science. And the science changes every year. So I know one of my professors used to say 5 years out of medical school, half of what you have learned is already obsolete. So you have to be constantly learning about things. So to build up that character and to build up that potential, it takes a lot of time. But once you reach that peak, that's when it becomes really fulfilling, and then that's when you kind of your growth is exponential in nature.
Absolutely. Every young doctor, once they reach that stage, they have this feeling like आगे और स्पेशलाइजेशन करें. शुड आई स्टार्ट मेकिंग मनी? शुड आई स्टार्ट अर्निंग? शुड आई स्टार्ट माई क्लिनिकल प्रैक्टिस? शुड आई स्पेंड टाइम ऑन रिसर्च एंड मैनेजमेंट? या फिर मैं अपना स्टार्टअप स्टार्ट कर लूँ, किसी स्टार्टअप में इन्वेस्ट कर लूँ? सो लॉट ऑफ डॉक्टर्स आर स्टक इन दिस डिलेमा. So how do they come out of this dilemma to actually understand what do they want out of their doctor degree?
It's very interesting because I was in that dilemma, and I still get into that dilemma every now and then. What next? How to go about next?
Exactly.
So I think, see Kritika, I think it's very simple. It has to be passion. Healthcare mein, and I'm not just talking about doctors over here. I'm talking about the entire healthcare delivery system. Whether you're a doctor, a nurse, a technician, a paramedic, a pharmacist, even a manager of a healthcare organization, you need to be passionate. If you are not passionate, it becomes really, really difficult. Now, the problem with the young population, and which I can tell by my example, is it's very difficult to find your passion. So it takes a lot of soul searching. It takes a lot of hit and try to find what your real passion is and what your real area of interest is. So my just 2 bit of advice for all the young budding medical professionals out there is to try and find that. How do you find that? You talk to people, you research, you read, you go to podcasts such as yours. So if you do that, if you see what's out in the world, that's when you would realize, and that's when you will be aware about how things happen. For me, I never knew that going into an MBA could be such a big thing for me, or such a big push for my career. It happened to me after I started researching after my MBBS. But it took a lot of time. It took probably 6 to 9 months of my time to actually research about what career options I could pursue. And of course, I was blessed enough to be, born in a family where I could be, in charge of that decision making. A lot of people are not. But still, there are a lot of options that are out there. The thing that you have to do is you have to go outside your comfort zone and try to find it. And when you reach your passion, when you find the thing that is actually you're passionate about, the journey becomes really simple, because every day that you work, you're working for your passion and you're working happily, and that's what matters at the end of it.
But figuring out that passion, like that gap, like something that gives you the spark, there's something that has this fire in you alive, that I want to wake up every day and do this and this thing. Figuring that out, बहुत difficult है. It's very difficult to actually figure out.
So I'll talk about it from I'll give a very different analogy to it. So my daughter, she is right now 4. So she's coming into that age जहाँ पे बच्चे are very curious about कि हम क्या करें एक्टिविटी आउटसाइड
हाँ.
एक्स्ट्रा करिकुलर एक्टिविटी.
Yeah.
तो पेरेंट्स क्या करते हैं, तुम बास्केटबॉल ज्वाइन कर लो, स्केटिंग ज्वाइन कर लो, पेंटिंग, आर्ट, एक्टिंग, ये सब क्लासेस, अलग अलग तरीके की क्लासेस आप ज्वाइन करो. एंड देन ज्वाइन करके एट द एंड ऑफ इट व्हाट डू यू डू, यू लेट द चाइल्ड डिसाइड कि भाई वो क्या करना चाहता है. इट्स अ वेरी डिफरेंट काइंड ऑफ एन एनालॉजी, बट द थिंग इज कि अनलेस वो चाइल्ड सारी चीज़ों को एक्सपीरियंस नहीं करेगा, दैट चाइल्ड विल हरसेल्फ नॉट नो कि मेरा पैशन क्या है. नाउ दैट इज द पेरेंट्स टेकिंग चार्ज ऑफ द चाइल्ड. After a certain age group, when you're adults and you're medical graduates, you need to take that charge by yourself.
Right.
I believe you need, and it's very accessible, right? See, information, what the IT revolution and what 5G has done, it has democratized knowledge. If you want information, if you're hungry for information, आपको information मिलेगी. There is no way that information is not accessible to you, which was probably not the case 15 years back. So what you have to do is research, research again and again, try to find what actually sparks that thing. If need be, then do that thing, experience that thing, and yeah, whenever you find the right mix, you need to fail a few times, you need to fall down a few times to find the right way to walk. So I think that's probably the oldest line in the book, but it still stands
Like
true.
keep your eyes open for the things that are coming
Absolutely,
for you.
absolutely. And I don't know, probably 5 years down the line, I may not want to be doing what I'm doing right now.
Right.
We as individuals, so Darwin has told us that we keep on evolving as people.
Yeah.
So
And that's
we
the
may
whole
not
point.
have the same interests going further. So at that point, what I'm doing right now may not spark the same kind of excitement in me 5 years down the line.
True.
I'll have to find my excitement then.
That's a beautiful thought. So let's talk a little about doctors. Doctors are expected to be 24/7 available. Patients expect करते हैं कि हम जब भी डॉक्टर्स को फ़ोन करें, सुबह, दिन, midnight, they want them to answer it. Patients have also forgotten that doctors have a life, right? I mean, they have families, they have kids, they have their mental health to protect, and they cannot just expect doctors to be endlessly available. How do you train your staff, your hospital employees, your doctors to actually maintain that work-life balance, and how did you train yourself?
Yeah. I mean, yes, it's very, very challenging. See, behind every white coat that you see is a person who is absolutely overworked and is having a very difficult time managing their work-life balance. And it has become kind of a hallmark of our society. It's kind of fortunate and unfortunate. Unfortunate, of course, because, it is disregarded about how difficult medical professionals, and I'm not just talking about the doctors over here again. All the medical professionals, they have to work really hard. They have to be available at all time, and they have to be at their best behavior.
Right.
They cannot be at worst behavior or at poor, poor time of their life where they are, not at their best of behavior.
I mean, good days, bad days, you have to put a face.
When they are in front of the patient, they need to be at their best.
Yeah.
So that is very, very challenging. The good part about it is people do realize it. People do see that the medical professional, being a medical professional is still a very respectful work. It is still a very hard-working work. And I would rather want to be someone that people look up to when they are in trouble, and than people. Than someone whom people probably don't look up to when they are in trouble. So that's the case with a lot of medical professionals. So yes, there is a lot of intrinsic motivation that comes with it. But moving forward, I think that is something that we have to manage, because see, things have changed a lot. Expectations of people have changed a lot over the course of previous few decades. It is not similar what it was 10, 15, 20 years back. I see certain doctors of my hospital, I see my cardiologist, my orthopedician, them, going back home at 2 in the night, coming back again at 6 in the morning, attending CMEs on the weekends, not having enough time, of course not having enough time for their families, because you don't expect kids to wake up at 4 in the morning to, kind of have a good time with their mom or their dad, right? It doesn't happen that way. And you cannot expect them again to be up at 12 in the night to have a conversation with their parents. So that's where, a lot of burnout is happening, and that's where we see that progressively a lot of doctors and a lot of senior medical professionals, they kind of limit their practice and move on to other endeavors.
Right.
That kind of work-life balance is very, very essential to maintain. How they are going to do it, it's very, very individualistic.
Yeah.
I think we have to be very cognizant about how much we are working. We need to be very cognizant about what expectations we set out for our patients from us. We need to be very cognizant about that. And then, of course, the answer is team building.
Let's talk about you. I mean, you are heading Swasthya Kalyan Group as a managing director, CEO of Rajasthan Hospital. You have 2 kids, you have a big family, parents. How do you balance everything? And on top of that, I know that you're very disciplined as well.
So, I think you'll get 2 answers over here. One is my answer and one is the answer of my wife. I don't know which one is accurate. I feel mine is accurate. So, I think at the end of the day, what I realized over the last year or so is you have to compromise. So, where do you compromise is the question. I was someone who used to like going out socially every day, and now I don't go out more than once a month. I used to be someone who used to read about certain obscure things a lot, like politics and what's going on around in the world, in the world of politics.
Consume a lot of information.
It used to take a lot of my time. Had to kind of sacrifice that, not sacrifice, just give up on that. So the key to it is finding the right mix of what you would want to do and what you would not. So what I have done in my life is I have kind of eliminated those things that used to take a lot of my energy, but were not as fulfilling to me personally or professionally. So once you start to, kind of triage,
set your priorities right.
Yeah. So triage, again, a medical term. So you triage your priorities. You prioritize what you want to do. Once you do that, it becomes really easy. So for me, it was, coming back home at 12:30 and getting up at 7:30, 8:30 in the morning.
Right.
And I used to go to work at 9:30, 10. It has completely changed. I now am at work at 8:30 because I sleep early. Because I sleep early, I get to spend a lot of time with my kids in the evening and my kids in the morning. And I drop my daughter home. So I try to maintain that part. And then I'm fresh at work. I'm not, late at work because I start early. So I don't need to be at work till 9:30, 10. I try to be back home by 7:30 so that again I can spend some time with my kids, my family. So prioritization is the key.
True. So coming back to doctors, one of the toughest things about doctors is lawsuits. I mean, they're given lawsuits for being negligent even when they're doing their best. What are the hospitals doing to protect doctors from these kind of implications or adverse situations? Or what is your take on it? What is the right kind of information that a patient should know before actually going and putting these lawsuits against doctors?
So see, the answer is very two-pronged. So number one, we as healthcare professionals have to be extremely educated about our rights and responsibilities. So I'll first come to the responsibilities part. Our responsibilities are that we take due informed consent from the patients. We communicate with the patients and their families very, very thoroughly and transparently. We set out very specific expectations. We tell them what could be the probable outcomes, and at the end of it, we just try our very best for the well-being of the patient.
Right.
So I would say a majority of these we would call lawsuits, or rather public disturbances, are eliminated if we follow this very simple protocol. That should be our absolute responsibility. Then our right as healthcare professionals is that we are entitled to the same level of justice as anyone else. So if for any due judicial process, it has to be seen what was the intention. So a murder is not a murder if it is without intention, it's a homicide. So there's a difference in how you do it. So medical negligence and problem with the outcome cannot be correlated with each other. They are two very, very separate things. Medical negligence means that, and then within medical negligence, again, there is a willful and a non-willful negligence. So those are the kind of rights that we should be very aware of as healthcare professionals. See, as the society becomes educated, as the people become more well-meaning, they demand better service of care, and we should absolutely be willing to give that kind of a better care. We should be very, very thorough with our documentation, our paperworks, our setting out our expectations to the patients. So we that's the harsh truth. We cannot deny it, absolutely. And that's the way healthcare is going. That's the way healthcare has gone in the West, where the things are really, really mature.
But let's say if the things go south and there is some sort of negligence that has happened because of which there is some adverse situation, patient ke saath, unki family ke saath, something has happened, then how does the hospitals take care of that situation?
So we take care of those. So usually there are certain insurances. I'm just being very technical about it. So there are certain insurances called the indemnity insurances, which kind of indemnifies the doctor or kind of takes care of the malpractice part. It's called a malpractice insurance also. So kabhi bhi agar kuch bhi hota hai, the insurances take care of that. Of course, we are forever standing with the doctors to kind of fight, help them navigate their way through this entire process.
But what about the patients and their families?
See, that is the kind of place where we have to, and we are extremely balanced. अगर कहीं पे कुछ गलती होती है तो and someone either loses their life or they are harmed beyond a certain level of recovery. So in that cases, we absolutely take charge of things. We are very balanced with our approach.
Right.
And I'm not just saying Rajasthan Hospital, I'm saying most of the hospitals around the country. We are very, very balanced. See, no one would want to hurt or do bad to a patient willfully. It's usually a non-willful incident that happens. It's unfortunate, but it's the harsh truth, because we are not gods. At the end of the day, we try to be, but we are not. Maybe some kind of stress is there. Maybe there are so many different things. It's a butterfly effect. There may be something in the morning that has triggered something which has happened in the evening to a doctor. Maybe the mood was not there. Maybe the right equipment was not there. Maybe the electricity went off during the procedure.
Or maybe the assistants in the
there are just so many variables out there. You cannot predict very, very efficiently or with 100% certainty that things can't go south. What we have to do is to ensure and have some kind of contingency plans around everything. And we do, and most of the hospitals do. We are taught that way in our medical school. We are taught that way through various quality metrics and standardizations that we go through. So that is there. But at the end of the day, if things goes down south, of course, our approach has to be a very balanced approach. We have to take care of people, because I cannot go around and give care to every patient in the hospital and be liable for any kind of damage or be applauded for every good thing. So the doctors do their best. If things go down south, we take care of that also. And of course, we have to be very balanced with the patients and their families also, because we have to understand and empathize with what they are going through.
True. And I think there should be some reforms and some transparency also, so that the doctors and the patients and their families, they're well taken care of, they're well aware about it, and well informed about the entire
Absolutely.
process.
Transparency and information communication is the key. You have to be very, very transparent about what things are. And I'm telling you by experience, and most of the medicos will tell you by experience, if the transparency and good communication is there, you would not get a problem in,
Most of
probably
this,
99.99% of the cases.
Yeah.
It's just going to be that very, very remote cases or very, rare cases that it would happen where things go down and there are problems created.
Okay, Sarvesh, tell me something. Many Indians, they used to settle abroad, chasing better pay, better recognition, good lifestyle, standard of living, London, US, America. Now with the H-1B visa announced by President Trump, do you think it's going to help India retain top of the medical talents in India? And how different do you think it's going to help healthcare industry shape their up, in India? How it's going to help it?
See, I would absolutely tell you that India still retains their topmost talent, in spite of H-1B being there for over 20 years now. The quality outcomes that you see in most of the cases in India are at par with Western outcomes. Specifically in places where intervention is required, so say cardiology, orthopedics, the kind of outcomes that we give are at par with the top of the top hospitals in the world. Still, few of our very, very bright individuals, they choose to go outside India, not just because they want to earn better. There is sometimes an element of, as we discussed earlier in this podcast, about that work-life balance and about that quality of life.
Right.
But that has been gradually improving. You would see many people staying back in India, if we talk about just, percentages, you would see many people staying back in India because there are more opportunities now. There were lack of opportunities as well. The private sector is doing great work. There is a lot of upside potential for people who are very ambitious, who are very aspirational. So there are good opportunities, and with whatever is happening with H-1B, and I've been following it very, very, very closely. It is at the end of it kind of an ode to see, if I am the President of United States, my first priority and preference would be around my citizens. Same as with the Prime Minister of India. So what President Trump is doing, he thinks, maybe that's right or wrong, I'm not here to make that judgment, but what he thinks is best for his country, and what he thinks is best for giving employment to the people of his country. It could be right, it could be wrong, but yes, it creates a very good opportunity for us to bolster our workforces, to retain the that 1% or 2% talent that was still going out, to retain them. I would again not use the word topmost talent. I believe that the doctors here in India, we are retaining the topmost talent as well. Some of them are going out. We can retain them also. And that would absolutely galvanize our healthcare industry. And I'm very, very excited about that. I think it could be a blessing in disguise. Let's see.
Talking about the talent in medical industry in India, I think you put a fair point out there. The topmost talent, yes, it's there in India, because of which there's a lot of medical tourism business coming to India. Like, a lot of people from abroad are coming here for surgeries, for wellness retreats, for all kind of treatments. Like any hospital you go, maybe in Jaipur as well. Where do you see this growing, the future of medical tourism going in Jaipur and in India?
See, the reason... there are two reasons why medical tourism, or what we now call medical value travel, is coming to India. It's not, it's kind of divided into two aspects now. One is medical value travel, and the other is wellness tourism. So yes, wellness tourism, India has always been very huge in. We have, these ancient sciences, ancient medical sciences that are out there. Kerala is a huge example about how it happens. Rishikesh, Haridwar are other two examples it's happening. But the medical value travel essentially by the terminology means that we are delivering very good results at a very good value.
Yeah.
So people, so see, we have to understand about it this way, that not all the countries have as good a healthcare structure as India. We may not be very appreciative sometimes about the kind of healthcare delivery system that we have over here. But trust me, it is one of the finest in the world. I would rate it amongst the top 10 in the world, the healthcare delivery system that we have. And not every country has that. So what happens is that people who had that kind of affordability, or people who were almost at that level of affordability, used to seek their treatments at other places, preferably in Western Europe and United States.
Okay.
But again, that was really, really expensive. The results were there, absolutely, but it was very expensive. India has come out as an alternative. We give those similar kind of results, but we give it at a very, very affordable pricing. That's how the entire movement of medical tourism, specifically from Central Asia, from the SAARC countries, from Northern Africa, the Middle East, has kind of migrated towards India. In fact, even Middle East, the healthcare delivery system is not as good as ours. We get a lot of patients from these areas as well. I'm talking about the entire industry. So that's why this movement is there. I see a lot of potential. See, healthcare delivery systems for various countries, to grow them, it doesn't happen overnight. It takes years and years and decades and probably a century of good public policies to make that happen. We in India are blessed that our teachers, the people who started healthcare fraternity over here, have been pioneers in their field, and now India is one of the best healthcare delivery system. We have very good medical professionals.
When I was studying about medical tourism, जो एक चीज़ I heard कि why people from abroad are coming here, of course, cost expensive है बाहर, and यहाँ it's really valuable and reasonable for people, but also बाहर waiting period बहुत है.
So
Surgeries
yes, so waiting period, you can avoid waiting period outside also.
अच्छा, okay.
It just costs you more.
Okay.
So again, as I said, at the end of the day, it is all about the cost. आपको अगर skip करना है, you don't want to keep a 3-month waiting for getting some kind of a treatment. You need to pay your way out of it, and you can pay your way out of it. People do. The wealthiest of the wealthy pay their way out, and they don't have to wait for a month to receive their treatment.
Give me a little idea, like for example, if they want to go get a pacemaker in their heart, right? What is the cost that India and let's say the US?
I can just give you a very vague number, but I would actually kind of give you a couple of examples. So cardiac surgery, cardiac bypass surgery costs somewhere around $80,000 to $100,000 in the US. Cost around 35,000 to 40,000 pounds in the UK. And similar kind of a rate structure in Europe as well. In India, it happens between 2 to 4 lakhs. So what is that? Maybe $3,000 to $5,000. So that is, a multiple of around 20, 30. So
that makes it clear why people are coming here.
Yes, and we are able to deliver similar kind of results. See, making anything affordable without delivering similar kind of results, you won't attract people. So that's why I tell you that we are retaining the best of the best people out there. We are delivering very good results, and that's why we are able to attract these medical tourists as well. And I see a great potential in it going forward.
Wow, that's amazing. I think our healthcare industry is leading in some way and bringing India to the top. Okay, talking about hospitals, there is a whisper about hospital that about the revenue targets, like how doctors prescribe a lot of tests, a lot of medicines to meet their sales and revenue targets. How real is this system of targets in hospitals?
See, if I say that it doesn't exist, I will be very dishonest. It does exist. Does it exist at the very core, at the very fundamental core of our profession? No, it doesn't. There are outliers, there are those certain fringe elements within our profession who do that, and it's very unfortunate because our service is not like a hotel industry service. We at the end of the day save lives, and people put their trust in us to save their lives. So yes, it is there, and it's a very uncomfortable conversation that we as healthcare professionals need to have and need to pursue. We are collectively, I know personally because I'm part of a lot of associations, we are collectively trying to take efforts to minimize this practice. And we are sure that this practice would be minimized with time, because the outcomes that are coming because of this entire thing are not very encouraging for the people who are doing it. The kind of, the risk to benefit analysis that you do, the benefit of it are pretty low when compared to the risk. That being said, see, at the end of the day, it is a very personal choice that someone makes. It is to get it to an institutional level, it is really, really difficult. So, do you have people who don't do ethical work when they are in finance? Yes, there are people such as. There are people who use technology in, kind of scamming or duping people.
Yeah.
They are
Every
out
industry
there.
has. Yeah.
So, does it impact the people as much? Maybe not. Our profession does impact the people, and that's why we constantly have this conversation that the most expensive equipment that we have in our hospital is our doctor's pen. So if that pen moves nicely, you can make healthcare cheap or affordable. If that pen is very aggressive, then you can make healthcare that much more expensive for the patient. So we as profession needs to have very, very intense conversations about it. But I think we will find a solution.
I think that'll be beneficial for majority of population of India, and especially with the footfall that's coming to India. This is a very strong way of strengthening the healthcare system in India. Of course, keeping the hospital business in mind and how both of them can create a win-win situation for patients and for healthcare industry, right?
True.
Okay, moving on to the next question. So one of the biggest nightmares for family isn't just the treatment, it's the after. What comes after? Raising insurance, endless paperwork, cashless claims. Why insurance is so complicated in India? And how can we actually simplify the entire process for our patients and their families? Okay.
So what I want to say is कि जो incentivizations हैं तीनों industries के, तीनों verticals के, basically stakeholders के, hospitals, insurers और patients, वो एक दूसरे से अभी conflicted रहते हैं.
Okay.
हॉस्पिटल का इंसेंटिव क्या है कि अपनी सर्विस दे, पेशेंट को ठीक करे, और जो उसने सर्विस दी है उसके लिए एक फेयर वे में कॉम्पनसेट होए.
राइट.
और वो फेयर वे में जो कॉम्पनसेट वो होगा, दैट इज वेरी इंडिविजुअलिस्टिक. वो बहुत ही सेल्फ डिटरमाइंड होता है. यू कैन नॉट डिटरमाइन व्हाट आई फील इज फेयर फॉर मी, राइट? So whenever that is happening, there is a negotiation that comes in, and negotiations always create stresses.
Okay.
देन इंश्योरर्स हैं बीच में. इंश्योरर्स का इंसेंटिव है कि हम हमारा पॉट बड़े से बड़ा करें, मैक्सिमम बेनिफिशरीज को लें, पे आउट हम हमारा मिनिमम करें, सो दैट वी कैन बी प्रॉफिटेबल एंड वी कैन पास ऑन आवर बेनिफिट्स टू आवर शेयर होल्डर्स. सबका होता है. दैट इज एब्सोल्युटली फेयर. इट्स अ कैपिटलिस्ट इकोनॉमी. एंड देन पेशेंट्स का इंसेंटिव है कि हमने इंश्योरेंस अगर ले रखा है तो हमें सही ट्रीटमेंट मिले, सही जगह पे मिले, irrespective of the cost of the treatment. So you see, जब ये तीन चीज़ें एक दूसरे से aligned नहीं होंगी, so it creates stresses between all the three groups. Now this stress is something जो कि हमको minimize करना है. So how do we minimize this stress? There are multiple kind of things that have been happening in the world. There is a Kaiser model. So Kaiser model is where basically कि जो इंश्योरेंस कंपनीज हैं, जो इंश्योरेंस रन कर रही हैं, वो ही अपना हॉस्पिटल खोलती है.
ओके.
हेल्थ केयर सेटअप भी जब उनका होगा और इंश्योरेंस भी उनका होगा, सो देयर इंसेंटिव्स आर अलाइंड, मिनिमाइजिंग द कॉस्ट, गेटिंग द बेस्ट ट्रीटमेंट पॉसिबल, क्योंकि अगर आप कॉस्ट मिनिमाइज नहीं करोगे तो भी लॉस है, और बेस्ट ट्रीटमेंट नहीं दोगे तो बेनिफिशियरी आपका इंश्योरेंस लेगा नहीं और आपके हॉस्पिटल में भी नहीं आएगा. राइट, दैट इज द मॉडल विच देवी शेट्टी सर हैज इंट्रोड्यूस्ड फॉर नारायणा एज वेल. तो दैट इज देयर इज अनदर ऑप्शन wherein we standardize the treatment. Standardize the treatment, standardize the payout. But it has to have a very good grading system when it comes to healthcare systems. आज एक हॉस्पिटल जो कि कुछ स्पेसिफिक तरीके की क्वालिटी दे रहा है वर्सेस एक हॉस्पिटल जो कि उससे बेटर क्वालिटी की सर्विसेज दे रहा है, इफ़ यू स्टैंडर्डाइज एवरीथिंग एंड यू प्रोवाइड द सेम payout to both of them, then why is this hospital incentivized to maximize their quality? They are not. वो भी कहेगा कि मैं तो बिल्कुल basic minimum पे कहूँगा. So probably the answer lies somewhere in the middle. कि हम किस तरीके से सबकी जो incentives हैं उसको भी align कर पाएँ, and at the same time हम ये ensure कर पाएँ that the healthcare is used rationally. What happens with what we have seen with the public schemes such as Ayushman, such as all the different cashless schemes, is the way that they are sometimes exploited.
How? I mean, Chiranjeevi and then now Ayushman, I think it has helped a lot of people.
It has helped a huge number of people.
Yeah.
But that being said, there is certain small proportion where it is exploited also.
Okay.
How it is exploited is over-treatment. And I'm not just talking about the hospitals over here. Beneficiaries also, when they have everything handed out to them cashless, they also tend to overuse healthcare.
Okay.
आज अगर मुझे पहले मैं मेरा जॉइंट रिप्लेसमेंट, नी रिप्लेसमेंट करा रहा था when I was hitting 70 after taking all the due treatments, physiotherapy ली, medical management लिया, सब कुछ लिया, मेरा ठीक नहीं हुआ. I went through that entire spectrum. तब मैंने मेरा knee replacement कराया. Now I have a cashless scheme that enables me to get knee replacement anytime without any financial implication on me. What does it do to me? Doesn't it disincentivize me to seek the right treatment or go through that entire phase of exploring other treatment opportunities which can minimize or lower my pain or reduce my requirement for a surgery?
Oh, okay.
That is something which we are seeing a lot. We are seeing people who have access to cashless schemes come to hospitals even for the smallest of things. You don't need to have a complete body checkup every quarter.
Okay.
But some people want to do that because they have a free access.
Oh, okay.
Right. So, and for that specific part, there is a mechanism called copay that is introduced. Copay. Okay. So copay basically means if you are paying 100 rupees to the hospital, a certain percentage of that you have to pay directly, and the insurance will pay the other part directly. So in a lot of outpatient schemes that are out there, copay in the West, copay is a very effective mechanism to reduce or minimize overusage of schemes.
Okay.
तो आपके पास जब copay रहेगा कि यार तुम अस्पताल जा रहे हो, अगर 100 रुपये का तुम्हारा बिल है, 30 रुपये तुमको पे करने हैं, 70 रुपीज़ ही पे करेगा इंश्योरेंस, then you will be disincentivized.
Okay.
In some manner. So again, there are a lot many smart people out there, much more smarter than me, active in public policy or trying to figure out the right way how we can navigate it. But yes, having a complete cashless ecosystem with no implications on the patients also has a very major impact when it comes to access and affordability of healthcare. That's what I'm trying to allude to.
Of course, it has an impact on the healthcare industry.
Absolutely,
as well.
it does. You have to rationalize it somewhere, right?
Coming back to, I just want to pinpoint the paperwork again, because for a lot of people, especially a lot of people who come to hospitals, let's say the non-educated sector, they come to hospitals, they have those insurance also from private insurance that they have bought. Sometimes they come here सब कुछ कैशलेस हो जाएगा, पेपर्स लगाए थे, सब कुछ लगाते, क्लेम रिजेक्ट हो जाता है, एंड देन दे आर लाइक कि हम ट्रीटमेंट आगे नहीं करेंगे, पहले पैसे जमा कराइए, ये करिए, वो करिए, एंड इट पुट्स द फैमिली इन अ लॉट ऑफ स्ट्रेस कि एक तो हमारे फैमिली मेम्बर का ट्रीटमेंट का स्ट्रेस कि सब कुछ सही हो जाए, दूसरा उनके क्लेम्स रिजेक्ट हो रहे हैं, फिर क्लेम्स रिजेक्ट होने के बाद 3 महीने तक रीइंबर्समेंट नहीं हो रहा है. दैट्स एन अनदर बैटल टू फाइट. I mean, this is something, a very hard truth for a lot of patients
so
and their families.
if you look at it, see, we have to be very aware customers also.
Yeah.
Patients को बहुत अच्छा कस्टमर भी होना चाहिए, बहुत अवेयर कस्टमर होना चाहिए. तो जब इंश्योरेंस लेते हैं, डू यू हैव हेल्थ इंश्योरेंस?
Yeah.
What did you see when you took that health insurance?
That the returns are great, they will take care of us,
Yeah.
like, you know, especially the agent that's in between.
Okay.
They assure us with the kind of premium that we are buying, how much of recovery it has, the amount that we are signing up for, the amount that's get extended when this amount is, you know, exhausted.
Right.
And all
So
of that.
it is basically all around the premium.
Amount. Yeah.
Right?
Of
It
course.
is the premium that you pay and the coverage that you have.
Yeah.
Did you, when you bought, and trust me, I was in your shoes 2 years back, did you take, when you were buying your insurance, did you have a look at what the claim to settlement ratio is for your provider, for your payer, for your insurer basically?
No, I didn't.
Did you have a look at what is the average lead time that it takes for them to reimburse your claim that you have applied for? You know, those metrics are available at IRDAI website, the Insurance Regulatory Authority of India.
Is it like standard for all companies?
It's present. The data has to be submitted by the insurance companies to IRDAI. IRDAI compiles that data. It's a government authority.
Okay.
They compile that data and they publish it on their website. It's readily available on their website. So if there is Insurance One that is probably 1,000 rupees cheaper, but their claim to settlement ratio is 63%. Why would I want to go with that insurance? The 1,000 rupees, the insurance that is 1,000 rupees more expensive has a claim to settlement ratio of 96%. But coming back to the question, I mean, if you look at it right now, इंडिया के अंदर प्राइवेट इंश्योरेंसेस का जो सेटलमेंट रेशियो है दैट इज़ अराउंड 89-90%. इफ आई एम नॉट रॉन्ग, इट इज़ अराउंड 89 to 90%, एंड विच इज़ वेरी गुड, विच मीन्स बेसिकली कि 10% लोगों के क्लेम्स रिजेक्ट होते हैं.
Yeah, but you know, like claims reject होने के बाद they do reimburse, but the procedure of convincing them to actually reimburse the amount.
See, that is something which IRDAI is very actively working on right now. The GIC, the General Insurance Council, is very actively working on that. We have seen a lot of reform around it since past 2-3 years. The insurance company would no more go to a court to get their reimbursements, taken care, the settlements happening, because they know they will lose out there and they will have to pay the fee of their lawyer as well. So that is something which is improving. Again, we have to understand that we were 5% of our beneficiaries had private insurances in 2014. And right now, if I'm not wrong, it is somewhere between 25 to 30% have private insurances. The other people are covered through various other cashless schemes or government insurances, or government companies, the PSU insurances. So we are still very young. We are growing. As we are growing, we are learning the new areas where we can improve, and that would happen. But as customers, as consumers, we need to be more aware, because if we are more aware, we weed out those companies who are trying to exploit us. If we weed that out, I mean, it's all game.
So we have to educate ourselves no matter what kind of insurance we're buying into. Okay. Coming back to the hospital sector, and one of the most difficult times of hospitals, COVID. So every hospital has stories from COVID, shortage of supplies, heartbreaking moments, difficult situations. What's that one situation about Rajasthan Hospital that stuck with you and that reminds you of those times?
I mean, when I think of COVID, I just get two stories. One is mine and one is, of another doctor of our hospital. So I still remember 24th April 2021, my grandmother had just passed away the previous day, and I got so I had literally, kept my phone aside. It was aside for, say some 8 to 10 hours, and I got something like 300 calls during that period. There were 300 missed calls when I actually saw my phone. And I felt really, really selfish that I did that, because people who were calling were actually struggling, and that was a nightmare kind of a situation at that point. So I took it up again, started, managing everything. And suddenly at 2 in the night, I got a call from my hospital that the oxygen that was to be supplied to us is running a little late. And we only have 10 minutes of oxygen left in our hospital.
10 minutes?
10 minutes of oxygen left in the hospital for the supply. So now what you do?
Oh my God.
Do you want to be that person who decides that this person doesn't get the oxygen and this person gets oxygen? I mean, there is no one in the world with a healthy mental well-being who can take that decision.
Right.
It's impossible to take that decision. Rush to the hospital. My father and Dr. Virendra Singh, who's another director in our hospital, my father and him, they started the hospital together. Both of them also came, and there was such a big panic at that point. Then 15 minutes later, oxygen went to 0. 5 minutes later, the van for oxygen came, and we were able to plug in. Within those 5 minutes, 4 patients collapsed.
Oh my God.
We were able to revive them back, but 4 patients collapsed. So that is where, that is where I saw what my team is made up of. So we had everyone on ground trying to manage patients. We had everyone, carrying those small oxygen cylinders and concentrators here and there, running to save the patients. Just, it was a nightmare and very heartwarming at the same time. And then once that entire ordeal came to end, once the oxygen was supplied, I had 3 of my staff, very senior staff from my hospital, come to my office, and this is 3 in the night. They come to my office and they started crying. So what could we have done? It is just, we cannot, it is so much stress, we cannot live in this stress. We just don't want to come to work tomorrow. We are just absolutely, we didn't sign up to see people dying.
Yeah.
That was the amount of stress that was out there at that point.
Yeah.
And it showed both the hardships that we have to face as medical professionals every now and then, and at the same time it showed a lot of character that is built within people. And I would not say just my hospital again. It is that people have a lot of character in them, which kind of shines through in difficult times. And it's very heartwarming. And the other story that I wanted to point out is again very, very heartwarming and very touching at the same point. So our Dr. Virendra Singh, he was taking counseling of some patients, and there was someone who came in and said that my mother has to be admitted in the hospital because she has to go on ventilator. My sister has to come in the hospital and get admitted because she has to be taken onto ventilator, and we want to admit her over here. We are not finding any ventilator beds. Please just give her one bed with ventilator. And he was, we didn't have any beds with ventilator at that point. He said, we don't have any beds. We'll make it available as soon as possible, but right now we don't have. So this guy who came in, his mother was admitted in the hospital and was on a ventilator.
Okay.
And he said, my sister is much younger than my mother. Take my mother off ventilator and put my sister on ventilator. Can you do that?
Oh shit.
We just like got super active. Within the next half an hour, we created another bed in our hospital with ventilator, because that kind of, when you hear such kind of a thing from someone, it's absolutely impossible for you to not react onto that.
Right.
But again, like, it kind of shows what people went through during that time, and how not just medical professionals, even families had to make such difficult decisions, or were put in a position where they had to take such kind of decisions. So one thing that I always wish never happens is that this kind of a pandemic never happens. It was absolutely nightmare. At the end of it, if it would have gone off for another month or so, we were very sure that we would be piling, dead bodies here and there and everywhere, because at that point, during mid-May, where the entire thing just spiraled out of control, the patients were sick, their attendants were sick, the doctors were sick, the staff was sick. We didn't have enough staff because everyone who was there was sick, had COVID, was struggling, didn't have, a proper, were not healthy. So it was a very, very difficult time. But I'm very proud that we, the entire healthcare delivery system, the government of our country, and we are 1.4 billion people who kind of deliver healthcare with, such efficiency to such a large population. There was such good coordination between the government and the private players and the hospitals and the entire healthcare delivery system. We were able to navigate it with not, a nightmare or, a disaster kind of a situation. It was still pretty bad, but things could have been so much more worse. And we just navigated through those rocky waters and came out. But it was a very difficult time.
I'm sure. I mean, listening to the stories gave me goosebumps. Like from the way we perceive as mundanes, as normal public, we saw that the hospitals were hailed as heroes, like lives bacha rahe the sabki, but also accused for profiteering. What's your take on that? I mean, it was such a difficult time, healthcare emergencies, but also many saw this as a financial reset for hospitals. Many hospitals that were at the verge of bankruptcy, they were clearing their debts and dues and making good profits out of it. So was it really a financial reset for hospitals?
I would put it, see, again, I think there are some kind of the narrative that is out there is probably associated with a very fringe element of the hospitals or healthcare systems. I mean, we were not a very big hospital back then. We were 150 beds at that point. But there were bigger hospitals than us, much bigger hospitals than us. And imagine, none of the hospitals actually were allowed to fire their staff or reduce their healthcare workers that were out there. They could not reduce it because of course it wasn't humane. I was instructed by the government also to not terminate jobs.
Right.
For 1.5 years, we had probably 5% of the surgeries that we usually used to have. We had almost no other people coming to the hospital. There were no people who were coming to the hospital to seek treatments, even for legitimate illnesses and life-threatening illnesses, because they could not either move because of all the restrictions that were around there for movement, or because they were too scared to come out there.
Yeah.
Now, at the end of the day, we are responsible for all the different branches of a hospital, all the different specialities, the people who serve those specialities. So say if COVID patients were treated under the medicine, respiratory medicine, that subgroup, only that department made a profit. That profit actually spilled on to all the other departments because the other departments were not working at that point.
Yeah.
So basically we actually, that helped the other part, kind of keep running. We needed that to keep the lights on. So when we talk about profiteering, it may have happened in some fringe groups, but I know for a fact that a lot of hospitals suffered during COVID as much as any other industry did, because we also struggled with getting our usual work, our elective surgeries done, our the regular work that we had to do for the patients. We also missed out on those kind of things. So at that point, it was very difficult for us to keep the lights on, and I'm very proud to say that the government of our country actually came out and brought these guidelines of financial pay that would be paid out to hospitals. So they were probably, I don't even know any hospital who was not under those guidelines. So there were strict financial guidelines that this is how much you can charge, this is how much you will be able to do, and henceforth, whatever it may be. But yes, there are people who exploited that thing. Why did the masks and glove prices go up and spiral up so high during that point? It did, right?
Even the charges for ventilators. Like, I came across one incident where...
So ventilators, again, I would kind of disagree. It could happen in a non-institutionalized setting, but in an institutionalized setting, it would be very, very difficult to do that, because government was actually guiding our entire treatment charges. Government was driving each and every part of our treatment charges. This is how much you can charge. This is how much you can charge. If someone was doing something illegal, should have been were reported as well. And it is again not at an institutional level, it is at a very fringe level that it must have been happening. But then it happened, some people did those kind of things even with the medicines, remdesivir, tocilizumab, all kinds of medicines, all these medicines, some people were kind of hoarding it and giving it out for profiteering. That happens. I mean, we are not in a utopian society. There are people who kind of disrupts the ecosystem. I would not deny by saying that some of those were not part of our healthcare delivery system as well. They were, but again, they were very, very fringe. A lot of hospitals, I know a large majority of hospitals, the kind of selfless work that they did, putting their lives online, putting the well-being of their families online, because at the end of the day they had to. My wife and I didn't sleep in the same room as my wife and my daughter for 3 months during COVID, because my wife had just delivered my baby daughter, and I was, seeing the COVID patients every day. So for 3 months we slept in separate rooms. I did not actually hug my daughter for 3 months during that period, because I didn't want to pass it down to her. That is again a sacrifice that many healthcare professionals had to make, and they did make that. And I won't let it be sullied by certain narratives. Yes, it was there, but very, very fringe.
I think only from the person, the other side, like you in the healthcare industry, can actually imagine, like, we cannot imagine the kind of life that you've been through, because we were at home making jalebis and passing on judgments, but it was you guys were really working really hard to actually help people survive this through. So I think a huge kudos to the health industry and for...
Yeah, a huge kudos to the entire healthcare industry for that.
Okay, coming back to a little lighter segment, thoda heavy ho gaya na? So let's talk about the future of healthcare industry. So with robotic surgeries, AI diagnosis, AI reading scans, AI predicting the diseases and also giving treatments, where do you see AI going? Will it make healthcare affordable, or will it be another shiny layer on the top?
Yeah. See, so most of the healthcare policy leaders that you will see out there, they would define healthcare as a three-legged stool. Three-leg stool.
Okay, three-leg stool.
So this stool, if there is not even one leg functioning properly, it will kind of dwindle off and fall. So the three-leg stool is accessibility, quality and affordability.
Okay.
You need to have the presence of all three in order to create a good healthcare system. What I believe that AI is targeting and should target is accessibility.
Okay.
People get access to healthcare. Right now, India is struggling a lot with accessibility. You won't find lack of accessibility in a tier 1 city such as Jaipur or Delhi.
Okay.
But go to a peripheral city 100 kilometers away from Udaipur in rural Banswara, or say in rural Jaisalmer, they will not have any good hospital, or rather just a hospital for probably 50 kilometers, 100 kilometers.
Right.
I remember I went to I visited Mussoorie this winters the January 2025, and I asked them that where is the nearest hospital. So for them to take the patient to the nearest hospital, it was a 60-kilometer journey to Dehradun, which used to take around 2 hours. So what AI would do, and what I really want AI to do, is create that access. Create that access of, number one, preventive healthcare, where people can get access of knowing what their disease is, recognizing the disease patterns or the symptom patterns early, so that right interventions can take place at the right time. and then giving access to those people at their at their homes, at their houses, so that they don't have to travel far and further to get treatments, especially when things go down south. So that is what AI should be doing. That is what a lot of AI companies are currently aspiring to do as well.
Okay.
And then the other aspect of accessibility is also when you are, so for example, if my hospital is getting, if I'm doing 200 X-ray reportings a day, right? And my radiologists are doing that. We as humans have a certain level of span of attention, right? Some people may have it for 20 minutes, some people may have it for 2 hours. But then after that span of attention is broken, it may result in some kind of a problem in reporting. For this specific example, reporting of say an X-ray, that may not be at the same standard as it would have been. What AI does is not supplement the radiologists, but complement them in this aspect.
Efficiency.
So the efficiency increases, the outcome increases. What does that do? That improves the accessibility, because we can help more people out in that same amount of time, and it improves the quality, because we can do it with the same level of quality. And then the affordability comes in, because having that on board versus having some non-technical guy or a less proficient person come in to do that work, where my radiologist again has to spend equal amount of time. So that spirals up the cost of my entire healthcare delivery system. So that can also be reduced, because technology will always lead to reduction in costs.
But do you think it won't replace?
Right now, as things stand, I don't want to be very, very vehement about it, but I genuinely believe that if you look at technology, or rather AI is the scalpel, but the doctor is still the surgeon.
True, yeah.
So it can help you create those better outcomes, but will never replace a doctor, because the disease, a human body is so diverse. Every human body is different. The way it reacts to medicines, the way it recovers from a disease and illness. You need someone who is in physical form present to take those decisions and effectively, and to communicate those decisions effectively to the people.
Yeah, I mean, talking about an Indian mindset, we need somebody to give us the assurance ki, sab theek ho jayega.
Not just ourselves as attendants, I mean patient also.
Yeah,
right?
Exactly.
So see, a patient's, so many times we would have seen that a patient's recovery is based on the mindset that patient is carrying. Unless the patient doesn't give up, it's very difficult for the disease to win.
True.
The patient has to give up for the disease to win at certain point, especially for the long chronic diseases. So that kind of communication, that level of human touch, that is currently not substitutable. I don't know what the future holds. Never say never, as they say. But I don't see it disrupting the healthcare delivery system.
I believe that too.
For a very long time.
Yeah. Talking about, you said preventive care. One of the most promising thing that I see AI bringing is early diagnosis. For example, किसी पेशेंट को हो सकता है 8 महीने 10 महीने बाद कैंसर होने वाला हो, और वो साल में एक बार अपनी स्कैनिंग कराएं तो उसे पता लग जाएगा कि हाँ, यहाँ पे चांसेस हैं आपको ब्रेस्ट कैंसर या लिवर कैंसर होने के. So at that point of time, instead of waiting for that to become life threatening और आपको बहुत later पता चले, AI can actually help you with working on the cure, कि अभी से इस चीज़ पे कैसे वर्क करना पड़े ताकि आपको बाद में कीमो, रेडियोथेरेपी, इम्यूनोथेरेपी वो सब नहीं कराना पड़े. So do you think if this really becomes successful, कि AI diagnosis, early diagnosis इतना successful हो जाए, तो India can finally move from cure to preventive measures?
Yes, see, irrespective of whether it will be AI or technology, we will have to move towards preventive care if we want to contain and curtail our healthcare costs. If we just focus on treatment, our healthcare costs will increase so much that it will be absolutely unsustainable for us as a country to help and service our patients. We should absolutely, and it is the responsibility of every healthcare professional and every citizen of our country to focus on preventive healthcare. What technology does whether it is AI, whether it is equipment, whether it is any kind of, personnel or software or anything. What technology should effectively do and is effectively striving towards doing is preventive care. So I saw this product 6-7 months back, and it's still in trial mode. So it's a recorder. You cough, and by the pattern of your cough, it with 82% certainty can tell you whether you have tuberculosis or not.
Oh.
Again, 82% is not a very encouraging statistic. So, the two aspects to it. With 82% certainty, it tells you that you do not have tuberculosis. So there is an 18% chance that you may have tuberculosis, but this doesn't diagnose it. But then with 78% accuracy, it tells you that you do have tuberculosis as well. So there is a 22% chance where it will tell you that you have tuberculosis, but you don't have tuberculosis.
Oh, so that can also
Right.
be
So there are two aspects to it, which is called sensitivity and specificity. How sensitive a test is and how specific a test is. So that's just an example. But a lot many tests that are now coming are very, very highly, can find out and weed out the false negatives. We don't want to care as much about कि अगर if I tell you that you may be positive for certain disease at a preventive level at a very low
डर
cost,
जाएंगे.
तो आप डर भी जाओ, बट आप जाके अपनी जांच करा लोगे तो आपको पता चल जाएगा कि मैं नेगेटिव हूँ, राइट?
Yeah.
बट अगर आप पॉजिटिव हो और मेरी जांच ने ये बता दिया कि आप नेगेटिव हो, देन you will stop caring about it, right? You'll stop caring about it, मैं नेगेटिव हूँ, I'll be fine. So what technology is currently working towards preventive care is to minimize the false negatives. जो नेगेटिव हैं, मतलब नेगेटिव जिसने फॉल्स बताया, दे आर पॉजिटिव्स बट नेगेटिव इज बीइंग शोन. सो वंस तो वो ज़्यादा अभी चल रहा है उसका.
मतलब यू आर सेइंग कि हो सकता है एआई बता दे कि देयर इज अ चांस कि आपको फॉर एग्जांपल कैंसर है, तो एआई आपको लग रहा है कि वो बता दे दैट देयर इज अ माइन्यूटेस्ट चांस कि आपको हो सकता है, गेट योर टेस्ट डन, और टेस्ट आपको नेगेटिव बता दे. तो देयर कैन बी अ क्लैश बिटवीन एआई एंड
So see, it is never a clash because it will always be in conjunction. And इतना so see there is called a preventive मतलब an early what you say first level of diagnosis which is done by these screening tools. Screening diagnosis
PET
is
scans
there.
and all.
No, screening tools are very simple, like हाय जैसे फॉर एग्जांपल जैसे अर्लियर स्क्रीनिंग टूल्स क्या होते थे, आपने आंख देखी, आंख में पैलर देख के आपने बता दिया कि हीमोग्लोबिन कम है या नहीं है. तो राइट नाउ देयर आर सर्टेन स्क्रीनिंग टूल्स जो कि आपको बता सकते हैं कि आपने प्रिक किया, प्रिक करके आपको जो है ना बता देंगे कि भाई आपका डेंगू पॉजिटिव है या नेगेटिव है.
अच्छा,
ठीक है ना. their accuracy is debated. So those are screening tools. But then there are confirmatory diagnosis tools also. Those tools are extremely sensitive. तो confirmatory diagnosis पे पहुंचने के लिए या तो आप directly confirmatory tools से अपना check कराओ. Now those equipment which are highly accurate will be very expensive also.
अच्छा, okay.
Right? So that is the issue. You need to have very effective screening tools. So अगर screening tools weed out ये कर देते हैं, मतलब जो पॉजिटिव्स हैं उनको करेक्टली आइडेंटिफाई कर लेते हैं, चाहे डिग्री नहीं बताएं उनकी डिजीज़ की, बट पॉजिटिव्स को करेक्टली आइडेंटिफाई कर लेते हैं, और नेगेटिव्स को करेक्टली आइडेंटिफाई कर लेते हैं, चाहे नेगेटिव्स की एक्यूरेसी भी कम हो जाए तो भी फ़र्क नहीं पड़ता, बट पॉजिटिव्स की एक्यूरेसी अच्छी रहे. वो स्क्रीनिंग टूल्स अगर आ जाएं विदाउट इवन टेलिंग the level of disease, we just need to do a screening. Level of disease can happen at the second step. तो भी healthcare costs बहुत drastically गिर सकते हैं.
Coming to another question, from the students' perspective, like for the students, like aspiring medical students who want to leverage the combination of healthcare, like who are medical students, as I said, and also want to use AI revolution in the combination, what are the skills they should be really working at to work on both of these things together?
I think be very, very technology friendly. And so for example, something that I'm trying to work on right now is called prompt engineering. So, I'm very sure that you must be aware of it. So it is, for the audiences, it is basically having the art to know what prompt to put in to get the right result.
Right.
And, with prompt, the results, the quality of the results that is out there is really good. So, for example, I never knew how to code, never learned it, been a medicine guy all through my life. But I have been very technology friendly. So, what AI has empowered me to do is that those small programs that I have to make, or the small macros that I have to use on my Excel, or the small data analysis that I have to do to improve my efficiency. Earlier, I used to take help of multiple people running through various, kind of Excel files to do that for me. I can do it myself. And when I'm doing it myself, it actually empowers me to think about that thing from different aspects. Not, I don't have to work on the first thought that came to me. I can, keep on refining my thought. So when you are very technology friendly and you kind of, get good at prompt engineering, that's when the AI helps you to bring world at your palm. I think the healthcare professionals, number one, should, especially the students, should very, very work on their prompt engineering skills. The second aspect, though, is much more entrepreneurial, which is that there is going to be an entire plethora of opportunities that will open because of AI and have opened because of AI. It ranges from basically, good medical transcription to and ends with very kind of an agenting AI system wherein the prescription audits and everything are happening through the system, and it is kind of verifying whether what diagnosis you have written down is appropriate or not. There are a lot of data systems and AI systems that are coming in which helps predict in a critical patient when their next collapse could be and how to mitigate that collapse. So we right now need people who, number one, can develop those systems, but number two, people who can actually read those systems and take good clinical decisions using those systems. That is something which is currently pretty lacking in our existing human resource. And I would want to challenge or encourage both the budding healthcare professionals as well as the existing healthcare professionals who are at probably their middle age and want to take that next step to embrace this time, to embrace this technology overhaul. If they do that, the kind of outcomes that they will be able to give to their patients would be unprecedented.
Right.
So, yeah.
What are the AI tools that you're using, if you could like to share some?
So I use pretty much, so in my day-to-day work, I pretty much use 3 tools. So one is based out of, a kind of a predictive mechanism of my consumption in the hospital.
Okay.
So what it does is, it takes hold of my demand, season by season of various. So a hospital is like a huge a convenience store. We have a lot of medicines, a lot of linen. It's like a complete hotel plus a pharmacy store. So we have a lot of consumption of a lot of stuff. We have over 14,000 SKUs in our hospital which we purchase every month.
Oh, okay.
So what we have done is we have created a kind of a tool which helps us predict our demands by the month and by the time of the day. So by the month prediction helps us in buying the relevant stuff from
basically the inventory management.
The inventory management. So buy the necessary stuff and keep the lowest possible inventory that is possible.
What's
and the
name of that tool?
So we have developed it in-house.
Oh, it's like a private tool.
Yeah. We have developed
nice.
it in-house using, and using the plugins. And the daily mechanism helps us allocate staff appropriately. So if we know that the demand is going to be maximum between 12 in the noon till 4 in the evening, the maximum number of staff will be deployed at that point to take care of that tool. So of course it's very easy to analyze those tools using multiple methods, but what the plugin, the AI plugin, what it has helped us is create a dashboard, and real time it is constantly running entire time and gives us a picture about how we do these allocations and about how we maintain our inventory appropriately. So that is one.
Really nice.
The other thing that we are using is very widely is in our imaging. So help with our imaging softwares, the CT scans, the MRs.
Okay.
So the reporting aspect of it. So the AI tool is it's kind of a test tool. It plugs in, and the test tool reports the scan, and then a radiologist has a look at that scan and see whether that scan is right or not. So that test tool with the company that we are doing is kind of a pro bono thing. So we help them in identifying where the AI tool has gone wrong. So we are kind of at their test site, and the same, so that improves the efficiency of the AI tool, and then it helps us in reducing our time to report. So we are able to give out faster reports to the patients. And the third tool which we are currently in development is a mechanism wherein automated, it's kind of CRM, wherein automated reminders and automated perspectives go out to patients based on their clinical data. So for example, a patient has high lipids, high triglycerides, and the patient also has borderline diabetes, a borderline HbA1c level, and the patient also has some other findings, say the patient has a kind of compromised renal status. So it can take those 20, 30 variables, put them up together and come out with kind of a recommendation for the patient that what should be your appropriate time to visit the hospital next and what to go about in checking those. Now this is something which we are currently in very, very primitive stages at, because it requires it has some kind of privacy issues as well, when to talk to patients, when not to do that to patients. It shouldn't be like a sales call that it is time of that year where you would buy candles for your home because of Diwali. We don't want to do that. Also we should be respecting. So but we want this to happen to ensure that patients, as we mentioned, preventive healthcare comes at the forefront. So patients who require that preventive healthcare gets the right education and awareness about what are their healthcare needs.
Wow. I mean, I'm sure this is going to be really helpful for the hospital management as well, and of course for the patients as well.
Yeah.
This is the last leg of conversation, and I want to talk about मोदी जी ने जो ये विकसित भारत 2047 का मिशन सेट किया है कि वो इंडिया को डेवलप्ड कंट्री बनाना चाहते हैं बाय 2047. तो उसके लिए उन्होंने बोला कि सारी स्टेट्स ब्लाइंडली दिल्ली को ना फॉलो करें, वो अपना प्रोग्रेस खुद प्लान करें इन द इंडस्ट्री ऑफ हेल्थ, टेक्नोलॉजी, हेल्थ केयर. सो व्हाट डू यू थिंक हाउ जयपुर राजस्थान is going to strengthen the healthcare under this vision?
See, right now I believe, so at Rajasthan also our Chief Minister Bhajan Lal ji has kept a plan of making our economy $350 billion by Rajasthan economy $350 billion by 2027. If I'm not wrong, I think 27 or 29, it's supposed to be $350 billion. Specifically from healthcare standpoint, I think one target that we have to keep is to ensure, see, we are the largest state of the country, and we have these areas where still so if you look at Jaipur, if you go outside Jaipur, the healthcare system is still not as developed, even in our second or third largest cities, Jodhpur, Udaipur, Ajmer. There are good setups over there, but they're not
as good as Jaipur.
Those setups wherein you can just stay over there, get your treatment done over there, and you don't have the requirement, if things go down south, to move out to probably a Jaipur or go to a Delhi or a Ahmedabad. So one thing that we have to do very nicely is places where healthcare access is not there, to create the first level of healthcare access at those places. And private hospitals have to play their part over here. That there is an opportunity over there as well. And then the second aspect is that wherever the primary and secondary level of healthcare system is there, to develop a tertiary level of healthcare system. We don't want a person who is seeking the treatment of an angioplasty, a complex angioplasty, or a patient suffering from cancer seeking treatment, chemotherapy, to move out of their bases, to move out of their hometowns, because that increases your cost of healthcare a lot. That person will come out, वो जाएगा टैक्सी लेके, ऑटो लेके, बस लेके, ट्रेन लेके जाएगा, उसका पैसा लगेगा, डेली उसका खाने का पैसा लगेगा, स्टे का पैसा लगेगा, उसके साथ एक जना जो जाएगा, that person will mostly either be a young person or will be the main decision maker of the family, जो उस patient के साथ जाएगा. तो that उस जने की एफिशिएंसी भी ख़त्म हो गई, क्योंकि वो नहीं तो अदरवाइज अपने घर पे रह के, अपने होम टाउन में रह के काम करता, बट वो काम नहीं कर पा रहा है क्योंकि वो ट्रैवल कर रहा है, तो उसका वर्क भी कम होएगा. सो देयर इज़ अ लॉट ऑफ अपॉर्चुनिटी लॉस्ट फ्रॉम दैट. दैट इज़ वेयर आवर टारगेट शुड बी. एंड सेकेंडरीली I genuinely believe that the policy has to be made wherein we aid and help our current technology companies and to retain those technology companies in Rajasthan. If you see, there are very, very few good companies which are incubating currently in Rajasthan. As soon as they become big, they move out.
Oh, okay.
So we only have, if I'm not wrong, we only have one technology unicorn in our state, which is Kardeko. We don't have any other technology unicorn as far as I know. So we had an academy is from Jaipur, but they don't have the base in Rajasthan. So we have to retain those companies over here. So those people will help in building. They have to be given the right and our proximity to Delhi has to be valued. Why do these people have to move out to Bangalore or Hyderabad or Bombay? Why can't our government create kind of an environment over here where we retain those talents, we just encourage those talents. So I think somewhere we our policy makers are still stuck in a loop where we believe that private enterprise is motivated only through profits, which is not entirely wrong. We are motivated through profits.
Right, absolutely.
But then that also yields a lot of profitability, or rather a lot of affluence for the entire society. So many jobs are created, so many taxpayers are created because of that, and those people again hire further people below them. So that entire ecosystem has to be created, and that can be done if if our policy makers kind of just like think about it in a much more positive manner.
Right. So you think the policy makers also have to strengthen for us to work on this mission?
Yeah, we just cannot keep on doing various industrial summits and expect things to change. Things will only change when the things are actually executed on the ground.
Right.
We need to nurture and cherish the private enterprise, because those will be the people who will drive the growth for India to be developed India. Can you name any country in the world where private enterprise is not driving their development journey? Even when it comes to China, they call themselves communists, but the entire private enterprise has come up to galvanize the country to that status where they are right now.
True.
So that has to be there. It has to be a very, very symbiotic relationship between the government, the society, and the private enterprise.
Wow, that's one insightful information. I mean, I love the way the conversation has led. I mean, it's beautiful the way it's been unfolding. I think a lot of insights are there for every aspect of individual who's going to listen to this podcast. Okay, the last leg of conversation about spirituality. I love talking about this topic because I am a very spiritually driven person. तो जब मैं आपसे पहली बार आपके ऑफिस मिलने आई थी तो मैंने ऐसे देखा था आपने ऐसे टीका लगाया हुआ है. फिर मैंने आप पे जब रिसर्च करी तो मैंने देखा आप महाकुंभ गए थे. मैं भी गई थी एंड द वाइब वाज देयर. मतलब इट वाज सरियल. जो वहाँ गया है वो ही एक्सपीरियंस कर सकता है. हाउ वाज योर एक्सपीरियंस देयर? लाइक गिव अस अ लिटिल.
Yeah, I mean, I think it was a calling.
Yeah.
So basically, so this is what my wife tells me. I didn't, I don't still, kind of remember this thing. So around January, my wife tells me that किसी दिन हम लोग ऐसे ही कहीं बैठे हुए थे, and I told her कि इस बार अगर कुंभ में जाने को मिला तो अपॉर्चुनिटी नहीं लीव करूँगा, एंड मैं इतना का दान भी करूँगा अगर मेरे को कुंभ जाने की अपॉर्चुनिटी मिलती है. तो माय वाइफ टोल्ड मी कि अपॉर्चुनिटी तो तुमको ही बनानी पड़ेगी. तो आई वाज लाइक यार हाँ, पर देखते हैं. एंड द कॉन्वर्जेशन एंडेड ओवर देयर. देन वन डे बिफोर वी वर टू गो टू कुंभ, so it wasn't planned. So my wife was just scrolling through things, and we were just like sitting idly, and she told me that do you want to go to Kumbh? And I said okay. And उसने फ्लाइट, मैंने कहा फ्लाइट तो अब कहाँ से मिलेगी? उसने कहा लेट मी सी. We got one ticket which my wife took for the morning and one ticket which I took for the evening.
Oh.
We both reached over there. हम लोग जब पहुँचे उस टाइम पे एक्सपेक्टेड था कि आप एयरपोर्ट से एंड इलाहाबाद सिटी में पहुँचने में अराउंड 6-7, मतलब प्रयागराज के महाकुंभ साइट पे पहुँचने में अराउंड 7 आवर्स का टाइम लग रहा है, जस्ट 18 और 20 किलोमीटर 7 आवर्स का. दिस वॉज बिफोर आई बोर्डेड माई फ्लाइट. बोर्ड करने के बाद हम गाड़ी में बैठे, गाड़ी वाला भी कहता है कि 7-8 घंटे तो लग ही रहे हैं सर अभी. हम लोग 1 घंटे में वहाँ पहुँच गए. मुझे पता चला रास्ते के अंदर दैट वन ऑफ माई फ्रेंड्स फ्रॉम ड्यूक, उसका ब्रदर इलाहाबाद हाई कोर्ट के अंदर लॉयर है, एंड दिस गाय गोज आउट ऑफ हिज वे टू हेल्प मी. सो लाइक प्रयागराज में क्या है कि वो हाई कोर्ट के अगर आप लॉयर हो ना तो उसका कार्ड दिखा के आप कहीं भी जा सकते हो. तो उसने मुझे एक अपनी बाइक दी और एक बाइक उसने खुद ने ली. मेरी बाइक के पीछे मेरी वाइफ बैठी हुई थी. हम दोनों बाइक करते हुए और पूरे कुंभ में घूम लिए. एंड हम लोगों ने उस दिन जो मेन त्रिवेणी था वहाँ पे हम लोगों ने डुबकी लगाई, जिसके लिए लोगों को 6-6, 8-8 घंटे वेट करना पड़ता है. वी डिड इट इन लेस देन एन आवर. हम लोग लेटे हुए हनुमान जी के भी गए, हम लोग सब जगह जाए. पूरा कुंभ हम लोगों ने 3 to 4 आवर्स में उसकी बाइक पे घूम लिया. एंड एक दिन पहले मुझे पता भी नहीं था कि मैं वहाँ जा तो रहा हूँ पर कैसे मैं सब चीज़ करूँगा. नेक्स्ट मॉर्निंग फिर हम लोग बोट लेके मेन जगह पे पहुँचे, संगम पे. संगम पे भी हम लोगों ने डुबकी लगाई एंड वी केम बैक. एंड इट हैपेंड एंड कमिंग बैक की भी वी लेफ्ट एट 11 क्योंकि हमारी रात की 9 बजे की फ़्लाइट थी. बट मैंने कहा कि यार नहीं चलो चलते हैं, एयरपोर्ट ही चलते हैं. अब क्या करेंगे यहाँ पे, कुछ है नहीं करने को, लेट अस गो टू द एयरपोर्ट. हम लोग एयरपोर्ट पहुँच गए 12:30 एंड वी वर क्रिबिंग कि यार अब 8 घंटे 9 घंटे क्या करेंगे हम, फ्लाइट इतनी लेट है. आई वॉज अ न्यू एयरपोर्ट, कुछ भी नहीं है वहाँ पे. एंड देन वी गॉट टू नो दैट द पीपल हु लेफ्ट एट अराउंड 1 or 2 दे कुड नॉट कैच दैट फ्लाइट एट 9. इतना ज़्यादा रश हो गया था, ट्रैफिक हो गया था. So everything happened for a reason. It just happened because it had to happen. Nothing was planned, nothing was kind of expected. And as you rightfully said, over there I still can't put in words what an experience that was. And I had thought कि मैं जब डुबकी ले रहा हूँगा, हाँ, मैंने सोचा मैं डुबकी ले रहा हूँगा, मैं ये श्लोक बोलूँगा, मैं वो बोलूँगा. When I was doing that, my mind was empty. It had nothing in it. So it was probably the most I didn't expect anything from that dip. So probably that vibe cleared my entire brain and it just made it so much more pure that I did it without an expectation of anything else. So yeah, it was amazing. But yeah, coming to spirituality, I think spirituality for me makes me closer to my profession. But at the same time it has helped me personally a lot. So my spiritual journey is not very old. So I had a little difficult last 16 to 18 months professionally as well as personally. And for me, spirituality kind of gave me an outlay of all my stresses, both physical as well as mental stresses. And once I started doing it, and I don't like, spirituality for me is, and I think for a lot of people, is not about just, being religious. Religion is a part of spirituality. It's probably the way towards spirituality. For me, I would say it's a way towards spirituality is through religion. But what it has done for me, it has made me more calm. It has made me appreciate things around me more.
Grateful, gratitude.
Yeah, very, very, very grateful about things, and has helped me deal with failures in a much better aspect, much better manner. And finally, what it has done for me is it has made me very disciplined. I've always been a pretty disciplined guy professionally and personally, but that discipline has gone to another level when it comes to the entire schedule of the day, what we have to do, how we have to kind of break down the day into various aspects, and why to do it, because there are certain there are certain examples that we can take out from our texts as to why this time of the day is aligned to this specific kind of an
जैसे बोलते हैं ना
activity.
सुबह 4 बजे उठ के आपको मेडिटेट करना
Yeah.
चाहिए, and people say that praying में बहुत
Yeah.
शक्ति
So what
होती है.
spirituality has helped me is helped me find a reason about why to do it. So I have been a very scientific guy. So I need to have a good reason in order to practice something. What spirituality has helped me is find that reason that why I should be doing this disciplined kind of a lifestyle.
Right.
So it has helped me through a very difficult time, and now it has kind of part of my life. Yeah.
Wow, beautiful. I truly love when I speak about spirituality to anybody. So my husband वो ना बहुत बड़े शिव जी के भक्त हैं. So मेरी शादी के बाद I started going to महाकाल a lot. उससे पहले मैं कभी इतना लाइक शिव जी की पूजा ऐसे नहीं करते थे, बट जब से मैंने वो करना स्टार्ट किया है, आई हैव सीन मेजर चेंज इन मी इन द लेवल ऑफ कॉन्फिडेंस. बचपन से आई एम वेरी क्रिएटिव, बट कभी ना मैं कुछ एक्ट नहीं कर पाती थी कि आई वॉन्ट टू डू दिस, आई वॉन्ट टू परस्यू दिस. करनी मुझे 10,000 चीज़ें थी, बट आई नेवर एक्टेड ऑन इट. बट द डे आई स्टार्टेड लर्निंग अ लॉट अबाउट दिस एंड गॉट अ लिटिल स्पिरिचुअली ड्रिवन, अ लॉट ऑफ थिंग्स इन मी हैव शिफ्टेड, है ना. Praying has a different level. I don't know how many people relate with praying and all of that.
Don't you think it's kind of like you have this contentment that someone is watching over you?
Yeah, absolutely. कोई फर्क नहीं पड़ता कोई क्या सोच रहा है, आपको सपोर्ट कर रहा है नहीं कर रहा, आपके बारे में क्या सोच रहा है, आपके काम के बारे में क्या सोच रहा है, चलेगा नहीं चलेगा. एटलीस्ट यू आर टेकिंग द एफर्ट टू डू इट. होगा नहीं होगा वो तो ऑफकोर्स देखा ही जाएगा ना, बट एटलीस्ट यू आर टेकिंग द चांस टू डू वॉट यू लाइक, वॉट यू लव. So I think praying has given me a lot of confidence to do what I love. कोई आउटकम की चिंता नहीं. लाइक जब मैं कंटेंट बनाना स्टार्ट किया था, उसमें कहते हैं कंटेंट क्रिएटर के बिजनेस में कि कंटेंट में ना आपको एसिमेट्रिकल रिटर्न्स मिलते हैं. आप कभी नहीं एक्सपेक्ट कर सकते कि आप आज एक रील बना रहे हो, वो चले नहीं चले, 10 दिन बाद कोई रील चल जाओ और आप कहाँ से कहाँ पहुँच जाओ, है ना. लाइक फॉर एग्जाम्पल हाउ जाकिर खान, आई मीन वेयर ही हैज़ रीच्ड. आई रियली लव द वे अभी जो उनका नया वेव चल रहा है ना इंस्टाग्राम पे, वेयर ही इज टॉकिंग अ लॉट अबाउट wisdomful content. मुझे तो वो साइड उनका आई हैव फॉलोन इन लव विद दैट साइड. सो मुझे ऐसा लगता है जब अ पर्सन इज़ वेरी पैशनेट अबाउट समथिंग, अपने पर्पस ड्रिवन से काम कर रहे हैं ना, नो डाउट दे सक्सेसफुल, बहुत पैसा कमाते हैं, बट देन उनके अंदर एक अलग ही स्पार्क होता है जो पीपल कैन रीड द रूम, पीपल कैन रीड देम कि like this is the person who has a lot of spark inside. I think it was a beautiful conversation, Sarvesh. Did you enjoy it?
Oh, absolutely. It was lovely, and it's always nice to talk about things that you have a little knowledge about, because you can kind of portray it out. Otherwise अगर general conversation होती है तो फिर हमारी भी dumbness दिख जाती है.
I think it was one of a very insightful conversation. Thank you so much for being so open and so honest about, I think मैंने आपको बहुत सारे difficult spots में डाला, but you were truly honest about it. I am excited about how our audience is going to love and they'll give their insights about the podcast and what is their take on it. But on the whole, I think I have loved this conversation. If you'd like to give 2 words to our audience for the people who are trying to figure it out, उनका passion, medical industry में है, entrepreneur है, कोई भी industry में है जिनको या job ही कर रहे हैं, but they want to do something in their life. I mean, आपने doctor बने, MBBS करा जयपुर से, फिर आप MBA पढ़ने बाहर चले गए, and वो एक completely different profession था. मतलब doctor को छोड़ के now you're doing such all the business management and all of that kind of work. So it was a different level of calling, और बहुत guts लगे होंगे वो choose करने में. So one level of wisdom for those people जो अपने comfort zone से निकलने से डर रहे हैं.
I think the most important part is just believing in yourself and just surrounding yourself with people. So there is a saying कि आपको अपने केवल वेल विशर्स ही आसपास नहीं रखने चाहिए, अपने क्रिटिक्स भी रखने चाहिए. बट आई बिलीव कि क्रिटिक्स के साथ साथ आपको अपने क्लोजेस्ट उन लोगों को रखना चाहिए जो आपके चीयर लीडर्स हों. इफ़ यू हैव पीपल हु आर चीयर लीडिंग यू अराउंड यू, दैट्स व्हेन you kind of show your true your true potential. And for me, I've been very lucky. My parents, my family, my wife, they're like my friends, my closest friends, they're like my true cheerleaders. I can see in their eyes that they're truly happy when I do something, and that gives you so much more inspiration to work. So just surround yourselves with people who you value and who cheerlead you all the way. I think it's very important. देखो वो सब करते हैं, hard work everyone who wants to be successful knows कि hard work के बिना success नहीं मिलता. Everyone who wants to be successful knows कि उसमें risk भी होती है. I don't want to, say that. Everyone knows that.
Yeah.
But I think the most important thing that life has given me is it has surrounded me with cheerleaders, and I think everyone deserves a cheerleader who can kind of, help them move ahead.
And I think for the ones who don't have a lot of people around, they should also learn to be their cheerleader for themselves.
I mean, it's a very quid pro quo kind of thing, right?
Right. Yeah. Okay, Sarvesh, I took a lot of your time, but
no, absolutely.
I hope you
fine.
enjoyed, because I
Yeah.
enjoyed this conversation thoroughly.
No, it was a really good time. A very, very engaging conversation.
Oh,
And you had researched your subject well.
Thank you so much. Thank you for your time again.
Absolutely a pleasure.
Thank you. If there's one thing today reminded us, it's that true leadership in healthcare isn't just about running hospitals. It's about the vision, the empathy, and the courage to keep going even when the path gets really tough. And with Jaipur Inspires, our intention is to bring you stories, insights, and opinions of those strong visionaries जो आपको push करती रहें, challenge करती रहें, aware करती रहें, और remind करती रहें कि extraordinary चीज़ें achieve करना सिर्फ कुछ लोगों के लिए reserved नहीं है. If they can do it, so can you. So keep watching, keep learning. हो सकता है अगली inspiring story जो हम share करें वो आपकी हो.